With so many conflicting reports and rumors about the flu and flu vaccines, we understand that it's hard to know the difference between what is true and what isn't. In order to help our patients and parents, we have produced this video so you will have the real facts about influenza. Hi, Mrs. Howell. It's so nice to see you in Savannah again. How are you doing today?
Good. Actually, I was thinking about getting Savannah vaccinated against the seasonal flu and H1N1, and I've heard a lot of confusing information, and so I brought along some questions.
Why don't you tell me what's on your mind, and I'll be happy to give you the real facts.
Well, why do we even vaccinate against the flu? Isn't it just a cold?
That's a good question. Both influenza, or the flu, and the common cold are actually viruses. But unlike a cold, the flu is more likely to cause severe disease and in rare cases even death. Because it can be such a risky disease, a vaccine was developed to protect us.
So how do I know if I have the flu or just a cold?
Well, with a cold, you may get a fever, but more often you just have a runny nose or congestion with a cough, and it comes on very slowly. With the flu, it comes on suddenly, and you may get chills, aches, vomiting, and diarrhea. You feel very tired and very achy with the flu.
Okay, so then what's the difference between the seasonal flu and the H1N1 swine flu?
What most people don't realize is that there are actually many different strains of flu which can mutate slightly each year, so every year vaccine manufacturers have to modify the flu vaccine. So actually the flu vaccine is truly new each year because it's updated to protect against the newest circulating virus strains.
So the H1N1 is just a new strain of the flu?
Yes, as I was saying, flu strains mutate or change their identity a little bit each season, and occasionally we have a year when the flu virus changes even more dramatically. In the case of H1N1, the human flu virus actually crossed with virus strains seen in birds and pigs.
So that's why it's called swine.
Exactly. The H1N1 vaccine protects against this new strain of flu, and the seasonal flu vaccine protects against the three most common seasonal flu virus strains.
But wait, if the seasonal flu and the H1N1 vaccines are made the same way, then why didn't they just combine all four strains and make it into one vaccine?
The answer is that seasonal flu vaccine strains were identified earlier in the year, and the vaccine was already being processed for the fall flu season. Since the H1N1 virus didn't appear until the late spring, rather than restart the vaccine-making process, the manufacturers ended up having to make a separate H1N1 vaccine. Both vaccines are important because both seasonal flu and H1N1 can be around at the very same time.
So why was there so much talk about testing the H1N1 if it's just another strain of the flu?
The only reason you heard about additional testing is that they had to speed up the production of the vaccine. The seasonal flu vaccine and the swine flu vaccine are both safe, having both been tested, and they are not experimental. The process used to make these vaccines is monitored for safety every single year.
So if the seasonal flu strains and the H1N1 strains are around at the same time, doesn't that mean that I would have to get the flu vaccine and the H1N1 vaccine?
Yes, that's true. You need both. Like adults, children 10 and over get just one dose of vaccine for H1N1, and children 9 and over get one dose for seasonal flu. But with children like Savannah, who are under the age of 9, a second booster shot of both vaccines is recommended, as children's immune systems tend to respond a little bit more slowly than most adults. The booster doses are really important in order to protect your child.
But are there any bad side effects? I've heard about people suffering from paralysis and even dying. Then I've heard that there are no other side effects. What is the truth?
I am really glad you asked that, because many of these rumors are simply not true. If you receive the seasonal flu shot, it is important to know that the viruses in the flu shot are killed, so you cannot, I repeat, cannot get the flu from a flu shot. Sometimes minor side effects can occur, like soreness or redness at the shot site, low-grade fever, aches, or an upset stomach that tend to last only 1 or 2 days. On very rare occasions, flu vaccine can cause more serious problems, such as allergic reactions or nervous system changes. You may have heard terms such as Guillain-Barré syndrome or anaphylaxis. These things can occur but are very, very rare. More importantly, you need to remember that it is much more likely that an unvaccinated child will get flu bad enough to be hospitalized than it is for a child who gets a vaccine to have a severe reaction.
Sounds like the pros far outweigh the cons.
That's right. It's safer to get vaccinated than it is to risk getting severe flu and the potential hospitalization or even death.
What about the nasal spray version of the flu vaccine?
The nasal spray version of the flu vaccine is made with weakened virus and again cannot cause a true flu infection. Its side effects can be runny nose, wheezing, upset stomach, aches, and low-grade fever. In fact, the nasal spray has been shown in some studies to be slightly more effective in protecting us against the flu, but both vaccines are effective.
Now I feel better about getting Savannah vaccinated, but do I still need to get vaccinated even if I had flu-like symptoms earlier this year?
Actually, even if you have had flu this year, the CDC recommends getting both vaccines. If you already had the flu, the vaccine will simply act much like a booster dose. However, since most of us do not know for sure whether we had the flu or which strain of the flu it was, the safest course of action is to get both vaccines.
Well, I have to tell you, this talk really helped me. What should I do if someone in my family has flu-like symptoms?
Most children and adults with influenza do not need medication. Children with flu symptoms should be kept home until their fever has been gone for at least 24 hours without the use of fever-reducing medicine. Rest, clear fluids, and a healthy diet are the main ways to care for a sick child. You can always call us for advice if you are unsure of how to care for your child or if your child's symptoms seem to be worsening.
What about medications like Tamiflu?
Medications like Tamiflu are really reserved for patients who are sick enough to be hospitalized or who are in the highest risk categories for complications. These medications can have side effects, so we try to use them only when we need them.
What can I do at home to protect my family?
Well, we always recommend that everyone eat healthy, get plenty of rest, and exercise. But the single most important thing you and your family can do is wash your hands with soap and water frequently. Ideally, you should count to 20 or sing the happy birthday song twice while washing your hands. If soap and water aren't available, keep alcohol-based hand sanitizer in your purse, in backpacks, and in the car. Hand sanitizers can be just as effective. Also, be sure to keep your hands away from your face and cover your mouth and nose when you cough or sneeze. Finally, be sure to regularly clean all areas and items that are more likely to have frequent hand contact, like doorknobs, faucets, phones, and handrails. Remember, you can always reach us 24 hours a day, 365 days a year. We also post regular updates and information on our website at pediatricassociates.com. At Pediatric Associates, your child's health is our top priority. We do our best to obtain flu vaccine every year, but the supply of vaccine can vary, so we must rely on the manufacturers to ship vaccine as they make it. Ask us about the flu vaccine today, and if we are out of stock, please rest assured that we are doing everything possible to obtain more vaccine. Thank you for entrusting us with the care of your child.